over to Dr. Clayton.
Good morning. As of this morning, we are reporting 121 new cases. We have 1 new hospitalization. We have no new deaths to report. We do have an additional 54 individuals who have recovered from COVID-19. And yesterday there were 174 new tests, new negative tests that were performed. In total, we have 988 COVID-19 cases in the state, 45 individuals who have been hospitalized, including 6 deaths. In total, we have 261 individuals who have recovered, and we have a total of 8,308 negative test results. There are no additional updates for the community impact map. The list of counties where we have cases, the new cases that is Coddington 1, Lincoln 5, Minnehaha 115. The age range of cases, we have 7 individuals who are in the 0 to 19-year age category, 22 who are in the 20 to 29-year age category, 34 who are in the 30 to 39-year age category, 29 who are in the 40 to 49-year age category, 19 in the 50 to 59-year age category, 9 in the 60 to 69-year age category, and 1 in the 70 to 79-year age category. The additions by sex, we have 75 additional males and 46 additional female cases. One piece to note is that we have an additional 88 Smithfield employees that are part of our numbers for reporting today. So those 88 new cases of COVID-19.
Thank you, Dr. Clayton. We'll turn it over for a short question and answer period. Reminder, please mute your mic if you are not asking a question. I will unmute you all now. You can use *6 to mute and unmute your line. Any questions on the line?
Yes, this is
Megan Morath here with News Center 1. Sorry.
Megan, go ahead.
Quick question about, yes, as you've seen, states like North Dakota and Wyoming have been reporting more of a breakdown per county of presumptive positive cases, and just more of a breakdown than what South Dakota has given. Is there any particular reason, or what do you need to be able to report more of that breakdown?
Well, I guess I haven't looked specifically at what the other states are reporting by county, but we're reporting the information that we have readily available. So we'll continue to take a look at what other states are reporting.
We do. The other thing I would tell you is we don't have any. There's not presumptive positives anymore because the CDC does not confirm those cases. So that's not part of the scheme right now.
Thanks. And just to note that we do have the Secretary of the Department of Health on the line as well. She's the one who just fielded that secondary follow-up to that question. Next question, please.
Yesterday, the staff reported that Clay County went from 6 cases to 5 cases. What was the adjustment on that?
So I think that's a very good question, and it's important to note that we, in the process of investigating the COVID-19 cases, do identify sometimes when a residence of COVID-19 patients has either moved or we have updated information for where the test was performed. So it's not uncommon for our cases to transition sometimes in and out of those counties as we have additional information available through our investigation.
Another question?
Hi, this is
Adam
Amy.
St. Paul. Oh, go ahead.
This is Amy Perlitti from the AP. Can you hear me?
Yes.
Okay. I just have a couple questions. I'm wondering if you have a total number of Smithfield employees now that you can provide us who are positive. And also I'm wondering if you can talk a little bit about the trial of the hydroxychloroquine. I don't know if I'm pronouncing that correctly. But with that trial starting up, you know, the country of Brazil is stopping its trial due to some health problems that they've had during it. I'm wondering if there's any concerns with that trial and how widespread that drug will be available.
So what I can say is that we do have 438 Smithfield employees that are part of our COVID-19 case count, and I'll defer to the Secretary MALSAM-RYSDON to talk about the trial.
Sure. So we announced the trial that will be available statewide that is being led by Sanford Research, and we will also have sites with Avera and Monument. So we're excited that positive patients across the state will have access to this drug. Governor Noem was a very strong advocate at the national level to be able to secure enough of the hydroxychloroquine to supply this study. The study will have different types of participants. It will have individuals who are hospitalized who are positive with COVID-19. The drug will also be made available to other positive COVID-19 patients who would be served on an outpatient basis. Those two populations would be served in what's considered a registry styled study. The placebo-controlled randomized study part of the whole trial will be to test whether this drug will help on a prophylactic basis, and that will be made available to exposed healthcare workers who are negative and high-risk close contacts who are negative, but they're close contacts of people who have tested positive. The fact that there will be, that there are health implications for any study, of course, will be factored in, and so there will be close monitoring of individuals. In the press conference yesterday, Dr. Suttle with Vera was able to discuss to some degree that there are contraindications for this drug, and so individuals so there will be some screening that happens to ensure that people are safe while they're a part of the study.
Adam, St. Paul,
you.
Dakota Broadcasting. Just wondering, we've seen a large uptick in the number of positive cases over the last, week and a half or so, and Governor Noem said that those numbers would rise. So maybe it's nothing to be concerned about, and this was part of the model and whatnot. But do these large numbers are they cause for concern at all?
Well, I think it's important to know that, based on the assumption of how impact of COVID-19 will be experienced in the state, that we do anticipate at a minimum of 30% of the population, will become infected with this novel virus. And so, we are aware of the increasing numbers, and that's something that we're actively working, to identify those individuals through testing, to conduct investigation to identify, that they can safely, isolate to home, and that we identify their close contacts and that they're notified, really on that containment side of the mitigation measures. The other piece is some of the community mitigation pieces where we have focused on encouraging people to stay at home, as well as to have other sort of social distancing practices. Even with all of those pieces, we do anticipate that our numbers will continue to rise in the state. It's not unlike what many other states in the nation are experiencing at this time, and we are focused on preventing, cases as best we can.
This is Mark from the Pioneer.
This is Morgan.
Go ahead, Mark.
What is your guidance to first-line responders, paramedics, firefighters for reusing PPE such as face masks. And once those antibody tests come online and first-line responder show that they have a previous, they have previously tested positive for coronavirus, although they are not contagious now, would that guidance change?
So the focus on PPE use by emergency medical services staff is available. There's guidance from CDC specifically for that population, as well as additional growing guidance for how to potentially decontaminate personal protective equipment. And so, it also depends on what the PPE that those first responders, as well as any other healthcare professionals, are using in terms of its potential for reuse. The focus on the antibody test, I think, is important, and that will provide another tool to identify, who in the state has experienced COVID-19 and has resolved their infection. And so, the testing that I think is going to be coming out of this is not one where an individual would be able to identify specifically their acute infection, but it might help identify those who have previously been exposed. But there's a lot we don't know about the virus, including whether or not individuals could potentially be reinfected. That's an area that I think some countries are starting to see and identify whether that's a thing that we do need to be concerned about, and that really will help drive whether or not the individuals who, and what they're wearing for PPE will be need to be informed by that antibody test. But I would recommend, just as a generality, that individuals, whether they be healthcare staff or first responders, even if they have tested positive for COVID-19, that they continue to wear appropriate personal protective equipment to safeguard themselves.
Going back to the clinical trials with Stanford and the ones that were recently halted in Brazil, do we know, are they using similar methods, or are there two different methods during these trials?
This is Kim MALSAM-RYSDON. I can't answer the question about the Brazil study, but I think you could direct that question to Stanford as the lead researchers for that comparison.
Very good. I think I heard Morgan will be our last question here before we take off for the day. Morgan?
Thank you. Has every employee at Smithfield gotten tested yet, and is the testing free for them, and what contractor does the testing there? And do they have any hazard pay or workers' compensation for their diagnosis?
So, the question about testing all workers at Smithfield is, we do not recommend all individuals in any setting to be tested. We do focus on individuals who do present with symptoms of COVID-19. There has been there has been a guidance that individual health plans, do not require.
Right. So the testing is free.
Yeah.
So the Smithfield employees who have symptoms do not have to pay for that, and it is being provided by the Smithfield Health Plan provider, in addition to other local resources within the community. And we anticipate that there will be additional testing resources made available to this group, again, for folks that have symptoms, to ensure that they're able to access free testing. Smithfield also, in their notice on Sunday, indicated that they would be continuing to pay their workforce for the 2 weeks, immediately after their closure this weekend.
Very good. Well, I thank you all for joining us today, and plans will be to resume the call tomorrow.